Hey guys, I'm going to be discussing the expansion of Medicaid through the Affordable Care Act. According to Health Pack Online 2014, the percentage of Americans in 2010 without health insurance was 16.3% or 49.9 uninsured people. However, the implementation of the Affordable Care Act comes with hopes of increasing the affordability of health insurance and decreasing the number of uninsured. In terms of the expectations for each individual state, it is my understanding that the PPACA gives money to states in order to expand their Medicaid eligibility. However, states can decline without losing existing funding. The Act gives 100% federal funding for the first 3 years for newly eligible individuals beginning January 1st, 2014 and ending December 31st, 2016. A recent study examined the implications for healthcare access, use, and spending, and they projected that the expansion of Medicaid coverage under the Affordable Care Act offers the potential for significant increases in healthcare access, use, and spending for vulnerable non-elderly adults who are uninsured. Using pooled data from the Medical Expenditure Panel survey, this study estimates the potential effects of Medicaid controlling for individual and local community characteristics. Their findings showed significant gains in healthcare access and use for uninsured individuals who enroll in Medicaid coverage and have chronic health conditions and mental health conditions. With that increased use, annual per capita healthcare spending for those newly insured individuals is projected to grow from $2,677 to $6,307 in 2013, while their out-of-pocket spending would drop by $921. It is expected that these increases in spending would be offset, at least in part, by reductions in uncompensated care and charity care. This applies to adults with chronic conditions and those with mental health conditions. The findings of this study allude that extending Medicaid coverage to low-income uninsured individuals with chronic conditions offers the potential for significant improvements in healthcare access, gains in healthcare utilization, and increased protection from high healthcare costs. Going back to a statement made by President Obama in the bipartisan meeting, uninsured individuals are still being seen and treated mainly in the ERs, and as it stands or stood, is being paid for by the insured. Therefore, the expansion of Medicaid would serve as a means to an end to this problem as well as increased reimbursement. The 3 things that I learned from this course are: number 1, how to appraise the role of nursing in our changing society; number 2, how to analyze the forces affecting healthcare; and number 3, how to evaluate the purposes, functions, and programs of organized nursing as a means of affecting change. The importance of each of these points are intertwined and simultaneously affect each other. Simply put, before we can inspire change, we must first appraise our role as nurses in today's society, as well as possess a sound working knowledge of the current forces affecting healthcare as well as our future practice. I hope everyone had a great semester, and I look forward to seeing you in the fall.